Hey, thanks for being with us again. Thanks for tuning in. Joe DiMatteo of the Len and Joe Ask the Pharmacist radio broadcast. We broadcast live daily, 6 days a week. A number of stations around the country, XM satellite, Sirius satellite radio. Tune in. Obviously, if you've gotten here, maybe you've also tuned into our website or found our website. If not, lenandjoe.com would be a great place to go for a resource of information. Past shows, archive shows that we do, seminars and where we do them, and then also as well some of these postings. Background pharmacist, board certified in clinical nutrition, and doctor of naturopathy degrees, natural health approaches. I'm going to talk to you today about breast health, women's breast health. And the reason, what has spawned this in essence, is some of the discussions that we've had, in the previous postings that have to do with mammograms. And we did a mammogram in essence, part 1. We talked mammograms part 2. We further went into what we believe are some of the downsides of mammograms, but I didn't want to just leave it at that there was this negative, horrible downside, what's a woman to do, and then be perceived even in the professional community as being a heretic for questioning the safety and the validity of mammograms. It's not just me. There's been questions that have been popping up, and it's been as if popcorn's popping all around this country, and I believe in some European countries, some cumulative studies beginning to question the long-term safety and efficacy, and are we getting a net benefit? But those were in the previous 2 postings, and I would encourage you to go and watch those. What I wanted to focus on today is women's breast health. What can you do proactively? Starting as a youngster, well, I'm listening to this and I'm 48. I'm not a youngster, I'm 52. Well, you can influence your children, your grandchildren. Maybe you're a young woman with young children, a young daughter. This could be applicable. So let's just talk about, can a woman do some things functionally, practically, that improve breast health, reduce the incidence of breast cancer? And the question is, without doubt. Number 1, the lack of fiber in American society is a huge problem. Most of the literature shows that you can reduce by every 10 grams of fiber that you increase in your diet. You go from very little fiber to 10 grams, you can reduce your incidence and chance of breast cancer. This is everything else being equal, with no other changes, no other functional changes that you make. You can reduce by a 10-gram addition of fiber a day, 8 to 9% roughly, your incidence of breast cancer. You go up to 20 grams, I can reduce it by 17 to 18%. I go up to 30 grams of fiber a day, I can reduce the incidence of breast cancer well into the 20s, close to 30%. Why? High fiber, especially soluble fiber that is found in things like oats, a lot of fruits and vegetables. Soluble fibers will sequester a lot of toxins from the gastrointestinal tract, byproducts of your metabolism, liver detoxification, and usher those bad components out. Fiber is critical. Number 2, weight, obesity. Obesity is a huge problem in this country today. Insulin resistance. I eat poorly, low fiber diet, a lot of sugar, a lot of saturated fats. I start to spike my insulin levels. The insulin resistance then antagonizes or hyperstimulates the ovaries and encourages ovarian production to rise of estrogen and testosterone and diminishes progesterone. Progesterone must counterbalance the estrogen components that you produce. So, number 2, and critical, is weight, being overweight, having what is called insulin resistance. It doesn't mean it's diabetes. It can be a precursor to type 2 diabetes, but making lots of bad choices. Low fiber, high processed foods, lots of sugar, saturated animal fats. Let's move to number 3. A lot of saturated fats versus quality omega-3s, things like olive oil. There's literature that supports that just a woman consuming olive oil on a regular basis can reduce her incidence of breast cancer induction. So what we've got to do is shift away from a lot of the bad fats, the rancid fats, obviously hydrogenated fats, deep fried fats and move you more and more towards quality sources of omega-3s, olive oils, plant-based oils, and so on. The other area that we must talk about, antibiotic exposures. Antibiotic exposures is a huge problem. Some of the literature shows that a woman that has 25 antibiotic exposures over the course of her lifetime will potentially up to double increased risk of breast cancer. And it has to do with an enzyme in the gastrointestinal tract called beta-glucuronidase. Beta-glucuronidase will rise with increasing consumption of antibiotics. The researchers, this was back in I believe 2004, 2005, stated, well, now we have to find out which antibiotics potentially could be an inducer of breast cancer. They missed the boat completely. What they missed was it wasn't the antibiotic. What they missed is that it was the change, the altering in the gastrointestinal ecosystem that it was creating, especially with the enzyme beta-glucuronidase, which deconjugates or unlocks estrogen metabolites that have been bound up, ready for elimination via urine and stool, deconjugates them, unhooks them, and allows them to be taken back up into what's called enterohepatic circulation, back into your liver circulation, to have to be reprocessed, re-exposed to estrogen metabolites. Big area of problem today. So we talked about weight, we talked about low fiber, we talked about antibiotics, pesticides, and herbicides. One of the best things that you could do is attempt to eat as many vegetables and fruit as you can. Organic, one. Number two, locally grown, higher nutrient base, and less of where there are pesticides that are used. Another area that's used today is hormonal mimics, estrogen mimics, xenoestrogens. Pesticides and herbicides are xenoestrogens or estrogen-like mimics. They are molecules, chemical structures that mimic the estrogen that we're blaming a woman's estrogen. In reality, it is these mimics. Big, big problem. Poor liver detoxification. In many cases, women have liver congestive issues because of a poor diet over a long period of time that can aid and abet the enemy here. I know I'm going through this quickly. I may expand this into a breast health too, but for right now, I want to get through this and just give you some basics. Estrogen dominance. A lot of women are not producing enough progesterone. Progesterone counterbalances estrogen dominance. A lot of women have diminished progesterone production, not counterbalancing. Your progesterone production in the luteal phase, the latter third of your cycle, should be anywhere from 1 to 200 times the amount of estrogen that you produce. There are many women that it's 20, 30, 40 times, which is woefully inadequate. Low iodine status is linked to not only fibrocystic breast disease, but a higher rate of breast cancer that's documented in animal studies, mammary tumors. The other area is low vitamin D. If you've not had a 25 OHD level done, you need to have one done. 25 OHD. We find that women that stay in the range of 50 and above for a 25 OHD have a significantly reduced breast cancer risk. Hormones in meats and in dairy, big problem. Dairy in particular, injections that are encouraged and use insulin-like growth factors are a huge problem. Actually now cattle are being bred and cows are being bred to produce more insulin-like growth factors. Huge problem because these are precursors to insulin. They encourage insulin resistance, weight gain, and they start that whole ball rolling. Hormones in meats are another issue. There's no doubt that we consume entirely too much corn-fed types of meat today, which are very fatty, inducing, and rancid, or more on the omega-6 side of fats, which is a huge, huge problem. I know I've gone through that quickly. I didn't take time to break it down. Maybe in subsequent teachings I will try to go through and do maybe a deeper analysis of what we need to do, how probiotics can help you, how weight loss can help you, how good quality omega-3s can help you, how sometimes a little liver detox protocol can help you as well. Thanks for tuning in. Tune in to Len and Joe, the Ask the Pharmacist radio broadcast. If you've been with us here for the first time, we invite you to go to our website at lenandjoe.com. Thanks for tuning in. God bless. Have a great day.